Right, so this video today is going to be about the complicating terms, terminologies that actually are related to sepsis. So you might have heard like a collection of terms: systemic immune response syndrome, sepsis, severe sepsis, and septic shock. So what do these terminologies? I mean, they all pretty much sound the same. Like now, you have to like understand where this actually is being taken to. So, all in the sense, it's a response to infection. So, let's start from the first one, which is the systemic immune response syndrome. So, it basically is the common, symptoms that you talk about when an individual gets a fever. So, it is what? Fever, tachycardia, tachypnea, and an elevated investigation count where you have increased WBCs. Now, add something like suspected foci of infection, like your lungs or some kind of wound, whatever it is. You add that to your concern, right? So it then moves towards sepsis. Now, from this point, now from so we came from SARS to sepsis, and now how it's going to go to severe sepsis. So when it goes to that, so what exactly happens there is there's an organ involvement, right? Multi-organ involvement. So this is where you see elevated creatine levels, maybe liver function. So you're starting to see organ dysfunction. When this organ dysfunction is persistent, right? When this organ dysfunction is persistent, then that's when you start to get the hypotension and the progression towards septic shock. So this is the the way it goes. So systemic immune response, sepsis, severe sepsis. So where there is organ dysfunction and it is persistent, and now it goes to septic shock. So now you can ask me, like for an example, what is the management? So the management is usually according to the ATLS protocol, like you'll be just going. But as far as this infection is concerned, there's something known as the septic six. Give three and get three. Get three and give three. And this includes, so what you're going to give is oxygen, fluids, antibiotics. What you'll get is blood culture, measurement of the lactate through ABG, because you will have some tissue hyperperfusion, hypoxia, and measurements of the urine output, because again systemic involvement will, all this will help you. But in addition to that, yes, there are investigations, serial every other day investigations will go on.